This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
Hello, everyone, and welcome to Caregiver Chronicles. My name is Sarah, and today I have Dr. Mitchell Clionsky with me. Dr. Mitchell is a board-certified neuropsychologist who specializes in cognitive impairment, dementia, ADHD, and brain injuries. He has more than 30 years experience in his field. He is also the co-author of the book with his wife, Emily. They are the co-authors of the book Dementia Prevention, Using Your Head to Save Your Brain. Hello, Dr. Clionsky. How are you? And welcome to our show.
Thank you, Sarah. It's a real pleasure being here. And I'm so glad that you talked about both my contribution as well as that of Emily, who is board certified in psychiatry and neurology and is the medical mind behind a lot of the facts and the important science that goes into our book. So it's really very much of a joint effort, something that I wouldn't recommend for most couples to do, write a book together, unless you really want to test the limits of your relationship. Fortunately, everything came out good on the other end. All the pieces were picked up and everything was glued back together. So it's real good now.
That's awesome. Thank you so much. And congratulations to her too on her contributions to the book, because it sounds like they were incredibly important. So I guess, well, do you want to further introduce yourself to my audience?
Sure, happy to. So as you say, I'm a neuropsychologist. Most people don't run into a lot of neuropsychologists. So what we do is we use tests of attention, tests of memory, problem solving, abstract thinking, intelligence, all the different things, all the functions of your brain. And we use those tests to figure out how someone's brain is working. While an MRI scan or a CAT scan, or even a PET scan, will tell you largely how your brain looks, it won't tell you how your brain works. And that's really important data, because we work in a field where things like dementia, which is a progressive decline caused by neurological problems. So it's a brain disease in which your thinking and your functioning declines over time. How do you measure that? Well, you don't get to it necessarily by a blood test or a picture. You get to it by measuring how the person performs. We do it in a very objective, very standardized kind of way. So while people often will tell us, I've forgotten what I walked into that room to do. I forgot where I left my coffee cup, or where I parked my car when I went to Disney World, or things like that. Sometimes those are very normal kinds of behaviors, especially as we get into our 60s and 70s and older. At points, though, that may become a problem. It may actually reflect that your brain isn't working the way it should. We take it out of the realm of the complexity of everyday life. It's sort of like, asking, are you gaining weight or are you losing weight? We say, well, step on the scales. We're sort of the bathroom scale, so to speak, of neurology. We tell you objectively how your thinking works. And that allows us to help make diagnoses to say, is this normal? Is it declining? Is it really an impairment now that causes us to say you've got a dementia, something like Alzheimer's disease or vascular dementia, or one of the many other types of dementia? And more importantly, it gives us a starting point for figuring out what can we do to, first of all, stop it from getting worse, and then to see if there's something we can do to make it better. So that's what I do and I've been doing now longer than I'd like to remember some days, but my career is actually 45 years this year. So it's been a very long time that I've been doing this. And I see anywhere from 600 to 700 people every year who have different diagnoses related to dementia. So I see a lot of this, have a lot of experience. And then to top it off, when I was in midlife, my mother developed dementia. So I got to really experience this, unfortunately, from the caregiver's side, as well as from the professional side. Believe you me, I'd rather be on the professional side. Caregiving, as you know, is a really tough job. It pays very poorly. And it's something that we have to do out of love, because nobody could possibly pay someone enough to do this voluntarily for someone that they're related to. It's something that's a real gift that we give someone else. And so I experienced it for the next, I don't know, 10 years or so during my mother's decline with dementia, which inevitably ended in her dying in her mid-80s. So I've seen both sides of this.
Yeah. I have well, first of all, thank you for your introduction, and thank you for saying, as a medical professional, and I would echo that as a former nurse's aide, it is so much easier to take care of somebody that you're not related to than it is to take care of your own family. I think that is the hardest thing you can do. Um,
And it doesn't give you enough distance sometimes. Now, one of the things that I did, because my mother was so different than the woman who raised me after she got dementia, and I started thinking of her by her first name, Muriel, as opposed to Mom, because Mom was just a little too painful, and she was a lot different than she had been. I needed to preserve that image of who she had been growing up, this highly capable, extremely loving, very articulate woman who at that later point in her life could barely speak, in fact, lost her ability to speak at one point, lost her ability to walk as she progressed in this dementia, and who did things that were very unlike her old self. So it gave me some emotional distance. I've used that at times with some of the families of my patients when I talk with them about how they need to assume a different role, in terms that they're now the caregiver rather than the one being cared for as they were when they were children. Sometimes that relabeling of who that person is allows them to take on a little different role.
yeah, I think that that's really interesting advice, and really good advice in a way. We don't realize how much that impacts us. And I also want to just kind of talk about the fact that you're an expert in dementia. You've worked in dementia for years, and then your mother gets this diagnosis. I just want to say that this is I just to people at home who are listening, because one thing that caregivers experience a lot of is caregiver guilt. What could I have done differently? How could I have fixed this? Um, you know, what did I do wrong? And it sounds like you knew exactly everything that could have been done, but it still happened. So can you just kind of help the caregivers with the guilt?
Yeah, that's a really good point. I will tell you something. At the time, I knew what I knew, which was the state of the art in the year 2000. It is no longer the state of the art in 2024. So looking back now, I say, ooh, missed this piece, missed that piece. Nobody knew those pieces back then. So at least I don't have to carry around any guilt in terms of how things could have been prevented. She got treated with the best possible combination of medications, which were out at that time. She got the best diagnostic studies, which were available. So I was spared that part of it. But I understand that kind of feeling that people have, where they look back and you piece it together. The first time something happens with a parent or a spouse, even, you write it off to stress. You write it off to busyness, to preoccupation, to something. Well, she did that then, but that's nothing. Everyone can make that mistake. It's only looking back when you start to put the pieces together that you start to say, oh, that was the first part of this. I just didn't recognize it when I was there. but now I do. But you can't change it. One of the things we talk about in our book on dementia prevention is that life is a lot like golf. You play it where it lays. Sometimes you're on the fairway, but a lot of times you're in the rough, or sometimes you're even in the woods and occasionally in the water hazard. So that's where your next shot needs to be. That's where you need to start. And if you hold on to the last shot that you took, the one that got you into the woods, that's not helpful. You need to figure your way out. So I often try to reorient people because they want to talk about, oh, what could we have done? How did we get here? What should I have done differently? And I'd say, I appreciate that. And I could spend a lot of time trying to reassure you, but that will not help you in this situation. Let's do the best we can going forward.
Absolutely. And I think that that's good advice too, is like to make sure you're going forward. Do you mind just telling, for my audience, anyone listening, anyone who's curious, what is the most common sign of dementia that gets missed?
There's a couple that overlap tremendously with normal functioning. And the reason we don't talk much about signs is that there is a huge overlay. For example, everyone forgets words at times. It's only when it gets to the point that you lose your fluency of speech that it really becomes a sign of dementia. If you're under stress, you forget words. You search for them. You can't quite come up with the right word. If you're nervous about something, you have to introduce someone to an important person in your life. You can forget their name for that matter, just because you're nervous. You can forget the word you want to use. We all lose things. We all set things down and forget where we put them. Our keys, our phone. Thank goodness we can call one phone from another. One of my patients says, I keep a landline because I use the landline to find my cell phone. She just dials herself. I've got this feature on my iPad and my iPhone called Find My Phone, where I press it and it rings. But, hopefully that's part of normal cognition. It's just, the busier you are, the more you have to think about, the more balls you have in the air. And if you're a caregiver, you're juggling an awful lot of balls. So you're going to forget things like that. Things are going to drop off your calendar. You're also going to have what we call source memory failures, where you can't remember where it was that you heard that story. You just know the story. All that stuff can be a sign of dementia, but in many cases is a sign of a normal person under stress. It's when you really, that's why it makes this very difficult. If I ruled the world, starting probably at age 50, people would have regular brief cognitive checkups every couple of years, starting in your 50s, increasing more as you got older, because you want to catch things earlier. Now there's a big push in the field of Alzheimer's disease for early blood testing to look for the buildup of beta amyloid plaques in the brain, back before people are symptomatic. The problem with this is that the technology to do something about those amyloid plaques, they can break them up by giving people very expensive kinds of infusions, but no one has demonstrated that actually will make a difference later on. And if it's a question of, should I start doing dementia prevention work early? The answer is yes, regardless of what your blood test shows. Because really, midlife particularly is a really important time for exercise. It's an important time for making sure that you have good control over physical problems like high blood pressure or diabetes. It's a really good time to quit smoking if you're smoking. It's a really good time to control what you're drinking in terms of alcohol. So there's a lot of things that you should be doing anyway. Doing more of them because you've got an increased level of beta amyloid in your blood isn't any better than if you don't have the beta amyloid, because there's a bunch of forms of dementia. And Alzheimer's disease, characterized by beta amyloid plaques primarily, and tau fiber buildups or dysregulation, is only one piece of it. It's only one type of dementia. So I advocate people getting their cognition tested as a baseline, just short tests, 10 to 15-minute kinds of tests as part of a routine doctor's visit. And then you sort of have that on file. So later on, if there's a departure, now it's sort of like your clothes, what size you used to wear. So now you can see if you've changed, because now you have to wear a different size.
I think that that's really good advice too. And I do agree with, there are, and I know this, there are so many different things that cause dementia, and to only focus on Alzheimer's is not helpful because most people with dementia usually have some type of mixed dementia. They might have Alzheimer's and vascular dementia or Parkinson's related dementia. And I know alcoholic dementia is also very common. I don't know if there is a specific dementia related to smoking, but I wouldn't be surprised if there was.
It's not the direct function. It is the fact that smoking raises your blood pressure. And oftentimes there's a relationship with people who smoke a lot, also drink too much. So it's a lot, and they also tend to be sedentary. So it's not so much the direct link. In fact, in our book, we build a model. We also have the same model, by the way, that's going to be coming up on our website really soon, that people are going to be able to take a quick test. They can do that now, but it's going to actually generate a dementia profile for them so they can see where their risks are. In this model, smoking affects hypertension, it affects obesity through secondary factors of raising your blood pressure and causing you not to want to exercise. The direct effect, however, is not so much with the dementia itself. It's the other things that it raises in between.
Yeah, I'm a huge advocate for anyone quitting smoking. I think it's one of the worst things that you can do for your body, if not the worst. I can't imagine anything too much more unhealthy than smoking. I really think it's the worst thing. So if you want to quit, there are resources. And you should, for just for your brain. If you don't care about your heart, maybe you care about your brain.
It's also for your pocketbook. Smoking has become a very expensive habit. One of my patients a couple of years ago was complaining bitterly that she couldn't take vacations. She had a hard time being able to get the hearing aids that she needed for her life as well as for her brain, because we know that hearing loss actually is a cause for memory loss. So if anyone out there is wondering, do I hear well enough? Go get your hearing checked. If you can benefit from hearing aids, you're going to really go a long way to helping your brain as well as your social interactions, your communication. But when we talk about their money, I said, well, let's talk about other things. Do you smoke cigarettes? Oh, yeah. So she smoked about a pack and a half of cigarettes a day. I said, how much are you paying for those? I said, I get them a little bit of a discount. I'm paying only $8. I said, okay, fine. So you're smoking $12 a day of cigarettes. Do you drink alcohol? She says, I do. How much? She said, oh, probably about 4 beers a day. I said, okay, well, that's not great for your health. You should only be drinking about 1, if that. Let's calculate that out. That's 28 a week. That's about, because I'm going to say you maybe drink a little more. That's like 5 6-packs. So we did the math. And what we looked at was that over the course of a month, she was spending enough that if she looked at that over a year, she could have taken a couple of weeks vacation. She could have bought a couple of those things that she wanted, but she needed a short-term fix. Same way why people gamble. So what can I do today? How many scratch tickets? In the hopes I'll get something big. And if not, I'll have the hope of doing that. But in the meantime, they're not saving that money. And then they feel deprived later on. So
Yeah.
sometimes you have to take a look at your habits, your lifestyle, and say, is this really a healthy lifestyle? And is one that's also going to benefit me in the long run?
Yeah, absolutely. And again, I'm with you. Smoking is it's even drinking is expensive. There has been studies on, people in the millennial and Gen Z generation, just with economic times being the way they are, not being able to afford to drink as much. And so they don't consume wine as much. There was even an article published that the wine industry is suffering. Um,
Oh, that's a shame.
because well, the younger generations they're not consuming as much alcohol because it's not a necessity. It's an extra.
Mhm.
And I'm all for, like, if you want to have a glass of wine like once in a while, go for it. I could never drink every day. Like, I can't. In
You
my
have to
20s.
practice. That's how
Yeah,
you get to drink every day. You practice hard.
Well, in my 20s, I mean, sure, but like I'm in my third, like I'm in my late 30s now. Like, not like I can't, I have to be up for the kids and alert. And I gotta be up in the morning and like ready to go. When I was in my 20s and I was working the second shift, fine. But but that's just not a thing anymore for me. So I like that advice of like quitting smoking, quitting drinking, exercising, eating well. These are all great things. What about puzzles and things like that? You always hear computer apps and things like that say, oh, this is good for your brain, or this app might help prevent Alzheimer's, or I say might with air quotes.
Yeah, it's an interesting thing. It's a very mixed research. We have to first understand that our brains are not muscles. So if they were muscles, then working them out more like we do with our muscles in our body would make great sense. The actual literature is very uneven. There are studies published that find certain apps for certain cognitive functions in certain people may be helpful. In most cases, doing online brain games makes you better at doing online brain games. The transfer of that benefit to everyday life is questionable. There's some studies recently I read that said maybe that does work, at least for some kinds of things. One of them said that they paired brain games with physical exercise they were doing at the same time, which was a very interesting study. And they did demonstrate, it was a fairly well-designed study. They did demonstrate that that combination worked better than either brain games alone, exercise alone, or doing nothing in those times. So I thought that was pretty interesting. But again, how long people will do that and how long it lasts. So the real in designing a study that you're really looking at dementia prevention, it's a longer kind of horizon that we're looking at because it's not going to show up in a month, 3 months, even 6 months. We're talking about something that you're following over the course of time. So that's what makes these studies particularly difficult. And we're not sure if short-term benefit actually translates into longer-term effect. Now, having said that, if someone says to me, I like doing these brain games, I have no problem with them doing it unless it interferes with them going and doing other things that are more personally interactive. Because I really believe that there's a lot of the social connectedness and the interactive problem solving from playing cards, playing mahjong, playing a board game with other people that makes it superior to sitting in front of an iPad or a computer or a phone all day, trying to see how many times you can press the screen in response to something that pops up. And I'm not a big fan of those because I don't think they really do a lot.
Yeah, I think that that's great advice, and thank you so much for that, because that's something that there's a lot of, again, there is a lot of fuzziness on that. And I know I do the Wordle and the New York Times, like the connections. I do those every day, but like
Uh-huh.
you can only do it once. It's not like, it's not like I'm sitting there doing Wordle all day. Um,
My guess is, though, that that's of no benefit to you because my guess is you already have a mentally stimulating life. So adding that to it is not going to, as spitting in the ocean. If you were sitting alone most of the day watching TV, maybe that would be a little better for you. But I think you probably, as most moms, especially with kids who have issues and things that they need, and your wife, and you're doing podcasts, and you have all these other things going, my goodness, your brain is probably moving in 5 directions at once most of the time. If it's
and
relaxing and you like it, go for it.
absolutely. And then you add, well, I do it because again, I do enjoy doing it. I do get a little frustrated myself with myself when I can't get it. And but then there's times I forgive myself if I don't get the Wordle and it's like a word where it could be like one of 200 words. I'm like, okay, in my defense, this could be any word that ends in ly. you
Yes.
know, and that's most of them. So so, I kind of have a laugh about it. It's something I do. Me and my husband kind of brag, like, oh, I got connections better than you did today, or I did the Wordle better than you. But it's just, just a little thing for fun. But again, back to the brain going off in multiple directions. Yes. And then you add ADHD to the mix, which is something it's even worse because it's like going off in all the directions and oh, a squirrel. But that's how I function somehow. But I know that you're also an expert on ADHD. And can you talk about ADHD and dementia? Because this is a concern that I know a lot of people with ADHD have. As the generation where we tended to be diagnosed with it more is getting older, a lot of adults with ADHD. I know my dad was diagnosed as an adult with ADHD after my diagnosis. Um, is there an increased likelihood for people with ADHD to develop dementia?
There has been some research suggesting that untreated ADHD can increase your risk. The other piece of this, though, is that for many people, ADHD and dementia share an underlying risk, which they don't think about, which is obstructive sleep apnea. So obstructive sleep apnea is a condition, a medical condition caused by your stopping breathing multiple times while you sleep, either because you've got a particularly small windpipe, particularly small airway that you're just born with, or you have enlarged tonsils that have never been removed, or especially in younger people, you're sedentary and perhaps overweight, so you're carrying more weight in your neck than you would. Postmenopausal women lose some of the protection of estrogen that increases their risk. It goes up anyway as you get older. But if you have sleep apnea, you stop breathing or your oxygen level declines by 4%, 5 or more times every hour while you're sleeping. It's a big cause of ADHD. So everybody I see with ADHD gets thoroughly checked out to see if they've got sleep apnea, because if they do, and we can treat the sleep apnea, they're going to have a better response to any stimulant medications that they take. They'll need less of it. They may not need it at all if they're getting enough oxygen. They're going to be more focused. They're going to be more able to manage life. They're going to have more energy. They're going to feel less agitated. In people developing dementia, one of the key underlying risks is sleep apnea. That same loss of air getting down your airway means that less oxygen gets to your brain, means that problems with the connections happen in your brain because there's not enough oxygen there. It also means that while you're sleeping, your brain doesn't flush out the toxins that have built up by thinking process during the day. There's a whole system in your brain for flushing out those toxins. It's called the glymphatic system. It does not work properly if you don't get enough oxygen to your brain. So that is somewhat of the reason why you can see an association between ADHD and later development of dementia. Also turns out that if you are in your late 50s or older and you're just walking around the general population, most recent research says that you have a 50% chance of having sleep apnea. 1 out of 2 people.
Yeah.
So that's a really huge amount. And if you've got memory problems, it's even higher than that. So I really think that, at age 50, they say you ought to get a colonoscopy. I say, great. If you're a woman, you should be getting mammograms regularly. Since I don't have to have one, I say, great. If I was a woman, I might not say great. I believe that everyone should really start getting a home sleep test every 5 years at age 50, because the sleep apnea is related to all kinds of other problems: high blood pressure, heart attack, risk of stroke, erectile dysfunction in men, which is a real big thing these days, as always has been, but now we talk about it. Even gout is related to sleep apnea. So it's a treatable condition. The test for it is cheap, 1 night, painless test in your own bed.
Yeah.
Why are we not doing this?
And most insurances cover sleep apnea tests too if you have a concern. So I think
Yes.
I think that that's a standard preventative treatment. So
It depends. I've seen insurances where it's no problem at all, and I've seen other insurances where people are diagnosed with sleep apnea, their test is not covered, and even the treatment has this huge deductible. It's crazy patchwork of insurances, but it's still well worth finding out what's going on because it could really save your brain.
yeah, I think that that's actually really good advice and advice that I'm going to personally take to heart.
I've done a bunch of podcasts. After we're done with the podcast, I get these little notes from the podcast host saying, well, thank you very much for being on the show. I'm going to get a sleep test next week. So I figure I'm doing the work of the Lord here.
No, I actually my sister had sleep apnea as a baby and does not have ADHD. So now I'm questioning, like, is there some kind of hereditary thing? My wheels are turning. But anyway,
You inherit the airway of your parents, just like you inherit many other features of them. So, we talked about before, we look back on what it is that we could have done, should have done. When I look back at my mom's dementia, now I recognize she, as well as most of her siblings, had sleep apnea. They would finish a meal, sit down to watch TV. Next thing you know, they're asleep and snoring. Looking back on it now, it's really clear that there's this hereditary thing. I've got sleep apnea. I've been using a CPAP machine for the last 18 years at this point, every night. And I've got more energy and creativity now than I did 18 years ago. So
that's
it's air's oxygen. What an amazing concept.
yeah. I mean, well, you need it to live. Yeah, absolutely need it.
Breathing. Well, imagine that.
No, I think that that's really interesting advice, and again, I think that I would have never have thought sleep apnea and ADHD. Like I would have never have thought that. So that's just an incredible thing. I want to talk a little bit more about like early warning signs and stuff like that. And I just kind of like opinion wise, for family members who have a loved one with Alzheimer's or dementia. One of the biggest early warning signs that I noticed in my grandmother, and I only picked up on this because of my experience in long-term care, caring for people who did not have that diagnosis of dementia until they did have some kind of form of dementia. Um, it's the personality changes. I think that that is the biggest red flag. If your loved one used to love, and I can't drive this nail home hard enough, and please let me know if you agree with this. If your loved one was someone who used to love going to the movies, and all of a sudden they don't, or they used to love to go shopping, and all of a sudden they don't, it's overwhelming for them, like more so than it used to be. I think that's when you need to have them evaluated if you haven't already for dementia, because those I think are some of the biggest red flags. It's those personality changes. Now those could be linked to depression and other things too, but how common are those linked to dementias?
So you're really talking about apathy, the lack of interest in things. And it often is a very early sign that someone is losing mental abilities. It has to do, in some cases, with the underactivation of the frontal parts of our brain. The frontal parts of our brain are the command and control centers. They're, interestingly enough, if you were to think about a car, our brains, if our brains were cars, the frontal lobes would be the gas pedal that says, go do this. Take it on now. Don't procrastinate. Get involved. Take action. But it's also the part that's the brakes. It says, no, 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 don't do that. Don't say that in that situation. I know that that little kid looks very cute. As an adult, you can't bend down and give that kid a kiss on the head without asking its parents' permission. And even then, you might not want to, because that's a disinhibited behavior. So it's both the gas pedal, the part that tells us to do something, but also the part that says, no, don't do this. It also is the part that helps us to stay on track, not to get off into 5 directions at once. So we oftentimes see disorganization as an early sign of deterioration in our brains. someone who used to be able to do a series of steps to bake or to organize a holiday meal. When my mom began to have a problem, the turkey went into the oven as we were about to sit down for Thanksgiving. I wondered why it was that the house didn't smell of turkey when I arrived. She says, "Oh, you're here. I've got everything ready. Let me put the turkey in the oven." I said, "Mom, it's dinner time. What's going on?" She says, "Well, we're having turkey and all this stuff, and everything else was done." Well, the turkey wasn't even started yet because she hadn't thought about the timing of it. So that's one of those things that you say, okay, this is a problem. We need to get more evaluation.
So
But,
those kind of things maybe a little more so than the changes in behaviors and like the apathy.
Yeah, I mean, apathy is a piece of it. The thing I'd like to stress is that don't wait for symptoms before starting prevention. You don't want to wait till you're smelling smoke from the house before you look for the fire extinguishers, before you pull the candle away from the window shade. You want to start earlier than that, so you hopefully never get those symptoms that you have to worry about later. And that's the whole idea about dementia prevention versus early detection. Early detection is great, and it's better than waiting too long. We could do more when someone's brought in a state of mild dementia than a state of moderate dementia. We can do even more when they're brought in and they only have mild cognitive impairment, which is the step before mild dementia. Got lots of options then. The ideal situation, however, is that they've done things which have reduced their risk of ever having mild cognitive impairment or mild dementia. Because the statistics tell us, as you'll see in our book, 1 out of 2 cases of dementia can be prevented. That's an astronomical number. If we had a treatment that cured 1 out of 2 cases, it would be the blockbuster drug. Everybody would be lined up for blocks to get this. We'd spend a ton of money on it. The stockholders would be dancing for joy because it would make such a huge difference. Well, tell you the truth, so would prevention. It would change remarkably the future of the economy and the number of people needed for caregiving, because more and more people keep getting older. We're living longer. So more and more people get exposed to dementia because it's an illness of aging. So if we can prevent those from ever happening, all kinds of positive things, both personally for the individual, but for society will also occur. So that's why our whole emphasis in reaching an audience is don't wait for those warning signs. Start early. Look at what your risks are. Make the changes in adulthood that prevent the problems in late adulthood.
Yeah, absolutely. In your book, and that's the purpose of your book, to help people. I want to talk more about your book. Prevention using your head to save your brain. Using your head to save your brain. I really like that title. And that's the whole purpose of your book. So let's talk more about your book.
So the idea of the book was for a physician and a psychologist to essentially scour all of the research from a wide variety of medical fields. Because one of the problems with dementia is that there aren't any dementiologists. It's interesting, isn't it? There's cardiologists, there's neurologists, there's pulmonologists, all these ologists for all these different problems. But dementia is sort of a stepchild. So we wanted to be essentially the first dementiologist. We wanted to pull in all this information from cardiology and endocrinology, the people with diabetes, the pulmonology, the people with breathing problems. We wanted to look at the addiction medicine, the people who deal with alcohol, the people who deal with genetics. We wanted to get all that literature, organize it into a model, and then translate it so that people could understand it and give examples and stories so that when you read it, it doesn't feel like you're reading a medical text. We do use medical terms, but we explain the medical terms in ways that people can understand, because this doesn't work if people read the book and it doesn't make sense to them. We want you to come out of this experience saying, all right, now I understand why this is related to this. And then we built in a questionnaire, 25 questions, that allows you to answer those questions and figure out where your strengths and weaknesses are, where you're on target, where you're off target, or where you're in between, sort of near target, and can just improve things a bit. That then becomes your game plan for the behavior change, which is the last part of the book, where we talk about how you can make changes, how you can get yourself to exercise regularly, how you can make some improvements in your diet, health issues, how you can look at things where before you felt powerless to affect change. And now you can see that you can apply a program that's doable, that you can stick with, and make the changes you need to make.
I think that that's amazing because I think a lot of times we're told we need to do like, especially with preventing insert illness here, because you can use it with anything, certain things. We're not told how or when or what ways to implement these changes. We're just told go home and change everything about your diet. Or you know what I mean?
Yes, yes.
Go home and exercise. And it's like, okay, but when and where and how? You know, or
No, you're absolutely right. And the devil is in the details. And that's why these things fail. It's easy for your doctor to say, you know, you got to lose a little weight. It's another thing for the doctor to say, here's how we're going to do this together. Emily and I are going to do a talk in September at a hospital in Pennsylvania. We've been invited to do a talk for the entire medical staff. And that's going to be the title of the talk. It's going to be focused on how you as a doctor can help your patients to make change. Because it's not enough just to say, go do it. Without the tools to do it, your patient's going to feel like a failure. They're then going to hide their failure from you, and it's not going to change anything. And you're going to come back and say, well, you still got the same problem. Let's throw in another medication. I would rather them spend their time figuring out how to break down the problem into small steps. And I'll give you a real quick one that people can start doing as they listen and finish this podcast today, which is they can go out and take a 10-minute walk. If they do a 10-minute walk 3 times a day, they will get 210 minutes of exercise a week. If their walk is brisk, fast enough so their heart rate goes up, but not so fast that they can't talk while they're walking, that's a brisk walk, they will walk about 9 miles a week. Amazing. Because it's only 10 minutes, they won't need to go out and buy special equipment. A rainy day will not be daunting unless it's flooding. It's rarely too cold. It's rarely too hot to do 10 minutes. You're not going to get lost. And most importantly, it works around almost all of your objections. That's why this works. It's like taking a nibble rather than trying to eat the whole sandwich in one bite. So if they can start doing that, finish the podcast, start by taking a 10-minute walk. A little later on, do that a couple more times. They will begin to put themselves on a pathway for being able to successfully get into an exercise program that they never had been able to stick with before. So you start small. But
I think that that's really great advice. And I think that you can even do a 10-minute walk in your house. I don't have a very big house. It might take me 2 minutes to get across it, but I could do a couple laps. You know what I mean?
Yes.
Like, can I do a couple laps around the kitchen table? You know, or can I walk up and down the hallway 5 times? Or there's, you know, I mean, if you physically cannot walk, that's one thing. You know, but as far as if you can walk, you know?
And if you can't, find a different form of exercise.
Exactly.
Maybe it's yoga, maybe it's Pilates, maybe it's Tai Chi, maybe it's a recumbent exercise bicycle, stationary bicycle, where because your back hurts so bad, this allows you to put your legs up and your back in a reclined position so that you're able to watch TV while you're pedaling. So yeah, exactly. You find a way, you modify it so that it fits your availability.
Yep. I love that advice. I think that that's great advice. I walk a lot with my kids because, we're always going somewhere and doing something. But I think walking is one of the best things that you can do for your body. And I think that as soon as you stop walking, if you can walk, you really need to, because when you stop, you lose that skill. That's that old nursing saying. I don't know if you've ever heard it. If you don't use it, you lose it. Um, and,
Yes,
and I think it's
absolutely. It's
true.
true. I tell people I want them to wear out rather than rust out.
Yeah. Yep, absolutely. I think that that's great advice. So I just kind of wrapping up on a few final things. Your website is full of a lot of great information and a lot of great tools. Can you tell my audience where to find it?
Thank you. Yes, it's called BRAINDOC, BRAINDOC, braindoc.com. And you're right, it's got lots of tools. It's got the questionnaire I told you about for free. It's got a bunch of other podcasts, both audio and video. It's got some articles that we've written. So there's a lot of different resources there. And it's all for the taking any time of the day or night.
Awesome. Thank you so much. And my favorite question to ask my guests, and forgive me, everyone, I know I asked out of order. I'm sorry. What is your favorite form of self-care?
Well, I use a CPAP machine every night. I walk either on my treadmill or outside with my dog or shopping in the big box stores. I do 10,000 steps a day. And I've got some guilty vices. I like to watch trashy TV shows while I'm on my treadmill. So if it's exploding, I'm there.
I think that's great though. And I do think TV can be self-care. Like you can do things that are good for you, like walk and watch Dance Moms or whatever crappy or whatever TV show you want. Sometimes I've been rewatching Gilmore Girls because it makes me feel good. Um or my husband loves Modern Family. It makes us laugh. Laughter is a good thing. Get your blood flowing. Um
And if you're lucky enough to have some people around you that you can love, the support, the interaction is so important for not only wellness of your soul, but wellness of your brain. So
yeah.
those connections are really critical.
Yeah. Oh, I'm a huge advocate for call a friend too, for self-care, or have a girls' night or a friend night, have a friend over, board game night. That is great for your brain and and your social, you're kind of getting multiple things done in one. Even if it's a stupid board game, it's good for everything. I love it. I love that advice. So I guess to everybody listening, I'd suggest you all try to plan a board game night with a friend, and you can do that as a family caregiver. You can have a friend over and still take care of your loved one and play board games.
Good advice.
Um, Thank you so much for coming on. And just one more time, can you give my audience your website?
Website is braindoc.com, BRAINDOC.com.
Fantastic. Thank you so much. Thank you so much for sharing your time with me. I want to wrap up this week's episode of Caregiver Chronicles, and I want to say to my audience, thank you guys for listening. If you're interested, please go to BrainDoc and hear more. I know that the link to the book is in there, and we will have the link in our show notes. If you liked what you heard in the show, if you know somebody who could benefit from this information, which personally I think everybody could benefit from this information, please share this episode with them. I think you should share it out to all your friends, everybody you know with ADHD, everyone you know with sleep apnea, everyone you know who snores. Share it out with them, and we'll see you next week.